Good morning. We have some exciting news for early stage HER2 positive breast cancer. This was a press release that was just published talking about the Destiny Breast 11 trial. This is a study that looks at neoadjuvant therapy for HER2 positive breast cancer. Right now, if someone has a HER2 positive breast cancer and the tumor is typically bigger than 2 centimeters or lymph node positive, we will give treatment up front before surgery. And that treatment is a combination of chemotherapy and anti-HER2 therapy. There are several different treatment regimens. The most common one that we use is TCHP, a taxane, chemotherapy, carboplatin, and then Herceptin and Perjeta, which are anti-HER2 medications. Then the patient goes to surgery, and then we continue HER2 therapy after surgery. Now, what this trial did was they wanted to look and see was if we give Enhertu, which is trastuzumab deruxtecan, it is an antibody drug conjugate, and it's currently approved only in metastatic breast cancer. They wanted to see if we give Enhertu with neoadjuvant therapy, will the outcomes be better? There's 3 different study arms. They had one group of patients who received Enhertu alone. They had another group of patients that received Enhertu, followed by taxane, Herceptin, and Perjeta. And then the third group that received ACTHP. ACTHP is another chemotherapy and anti-HER2 regimen that we can give in HER2 positive cancer. In the United States, we don't use that as much anymore. We've tried to get away from using the adriamycin, which is an anthracycline chemotherapy that can increase the risk for heart disease, but it is still more used internationally, which is why they included this study arm for this trial. And what they wanted to do was see can using Enhertu increase the rate of pathologic complete response, which means at the time of the surgery, there is no more cancer seen in the breast and in the armpit, because we know that having a pathologic complete response can lead to better outcomes in the long run. Now, for patients who don't have a complete response, we have medications that we switch to, such as Kadcyla. And what they showed, now this is just a press release, we don't have all the numbers, that will be presented at an upcoming medical meeting. I do not know which one, but what they showed was that Enhertu followed by THP had an improvement in pathologic complete response, which is so exciting. Will this become a standard of care or a new standard of care? I don't know yet. We're going to need to see the numbers, but I'm really, really excited to see the full results of the study. Let me know your questions and share your experience. If you did have HER2 positive breast cancer, what treatment did you receive and what was it like? Let me know in the comments.